Great. All right, we're now recording. Welcome to today's Wednesday webinar. Here in the blue link are all of the archived or upcoming webinars that we have hosted with this program. You can see we have about 5 planned for the rest of the year. Today we're going to be talking about Smart Choice Health Insurance Basics. We would like to thank our sponsors of the Mid-Atlantic Women in Agriculture program, as well as the collaborators. So send you a quick thank you to those that help with this program. Save the date, and we also will have updating projects available. With that, I'm going to go ahead and turn today's webinar over to Jesse and Maria, who will introduce themselves. Those of you that are listening, please use the chat pod if you have any questions for the presenters, any clarifications, please use the chat pod and we can help you out. Passing now to Jesse.
Well, thank you, Shannon, and good afternoon, everyone. Welcome to the Smart Choice Health Insurance Basics program. Today, we're going to cover some basic information to help you make a smart choice about your health insurance decision. We're going to discuss important things like terms, cover the importance of health insurance, and look at some things that you can do to choose a health insurance plan that best meets your needs. But before we get started, I'm going to cover the introduction. So my name is Jesse Ketterman. I'm an extension educator in the western cluster of Maryland, which includes Allegheny, Garrett, and Washington counties. And I'm an accredited financial counselor, and I've been part of our health insurance literacy team for a little over 2 years now.
And hi, I'm Maria Pepitas. I work with the University of Delaware Cooperative Extension. My area of focus is family consumer sciences with specialty in personal finance. I'm also an accredited financial counselor and have been working with the Maryland team for a number of years on health insurance and other personal finance types of topics. Glad to be here.
So before we get started, I know there were several materials that went along with the program. The one that we're going to probably focus on most, and you know, a lot of them are going to help you out, but we will be talking specifically about the workbook later in the presentation, so you do want to make sure that you either have that available and open on a separate screen, or some of you may have printed it out. And when you do respond in the chat box, if you could respond to all the panelists, that would also be helpful so that we can each see any response or any questions that you may have. So to begin, we want to start with a survey. I just sent in the chat box a link, and if you could click on that link. Now, when you click on the link, don't close the survey when you're finished. Answer all the questions and then minimize that screen. We just want to get an idea of your confidence right now, and then at the end of the program today, we'll do a follow-up to see what we call a pre- and post-assessment. So if you could take a minute to do that. Again, it is voluntary. There's an informed consent in the materials that you received in advance. You're not required to do this, but again, it helps us in terms of developing our programs. So if you could do that, click on the link that I sent out through the chat box, and then when you're finished, if you could go back into that chat box and just respond to all participants and say, done. That way I would know that the people finished that, and I can move on to the next slide. So I'm keeping an eye on the chat box while you complete the pre-assessment survey. And that's an example of the questions there on the screen. It didn't take long. So I got a message there. My voice is fading in and out. So I hope this is a little bit better. Still looking for a couple more responses in the chat box saying that you're ready for me to move on to the next slide. Okay, and as some of you finish, I will kind of review our goals for today. You know, what we know is consumers say they're confused about making health insurance decisions, and they're not sure about whether or not they're making a good choice. So today we want to explore some basic information that you need to make a smart health insurance decision. So our goals for today are to understand why health insurance prevents large unexpected healthcare expenses, to learn what to compare to understand cost and coverage, and identify some information needed to make a smart choice. And so when you understand this information, this is going to help you become more confident in making your health insurance plan choice. So I want to begin with a little story. I want you to introduce you to Jamie, our character here. Jamie works on the family farm. Jamie is busy with the duties of daily life, and so health insurance just hasn't been a priority. She hasn't thought about, or he hasn't thought about health insurance. But unfortunately, Jamie had an accident, slipped and fell, and had to go to the emergency room. The fall was pretty bad, and Jamie needed emergency surgery for a broken arm. This became a pretty stressful situation because Jamie was uninsured and had very limited savings. Like Jamie, many of us have fallen, slipped, or tripped. Most of the time we're lucky, but sometimes that can lead to a broken arm, as in this scenario. And the cost can be surprising. This accident was something that Jamie hadn't planned for. However, Jamie realized the very real cost of not having insurance. So if you could, in the chat box, tell me how much you think it would cost someone if they had a broken arm and didn't have insurance. What do you think that cost would be? So again, in the chat box, respond to all panelists and just give us a rough guess of what you think the cost of a broken arm would be. So I've got one estimate of $1,500. I've got one around $7,500. See if we can get a couple more responses here. See if we can get one more in there. So we've got a $6,000 estimate. So here we go, the cost of a broken arm. So the hospital cost in this situation relating to Jamie, there was $2,300 in pharmacy and drug costs, hospital supplies, a little over $2,000, and the emergency room cost was a little over $3,000. Then you have the follow-up with a specialist. So the cast cost $500. There were 2 visits. That cost $200, and then you had x-rays, which cost a little over $1,000. So without insurance, that total cost was $9,351.96. So again, remember that this is just one example based on one event, and rates and charges, they're going to vary depending upon where you live and the type of facility and the services you get, but it does give you an idea of how expensive just one accident could be, and what the financial burden would be if you didn't have insurance. So now I have a comparison between having the broken arm without insurance and one with insurance. So you can see here you have the premium. Of course, if you don't have insurance, your premium $0. There's your monthly cost. The deductible. So in this case, if you have insurance, there's a $4,000 deductible. And then you go through, again, the example that we're using here is the bronze plan from the health market. And then you go through there, you have some diagnostic costs, but there's 30%, you don't have to pay 30% after your deductible. And so, the deductible is not subtracted out there. But when you go through each of these costs, you can see the total cost there. $9,351 is reduced to $6,000 with the bronze plan, just by having insurance. So, that's a lot of money and a lot of savings. So that leads us to the question of why. Why do you need health insurance, and why is health insurance important? Two very important questions, right? And so let's see if I can get a response there in the chat about why health insurance is important. See what some of the participants may say there. Why health insurance is important. Looking for a response in the chat box there about why health insurance is important. So there's a risk associated with agriculture? Absolutely. It can help eliminate or reduce health care costs for both unexpected events and recurring appointments. To protect you and your family's financial security in case of a medical problem. And of course we don't want to go broke or get in debt. That's another example. So all very good reasons that we need health insurance. And so, again, just going along the same lines, that health insurance is a backup. It provides a peace of mind if you know that something may happen or there's a risk associated with it. Knowing that something you have there is a support in case something happens, definitely is going to provide you peace of mind. It's going to protect your family's financial future. Some of the studies that we're aware of, over 20% of Americans are struggling to pay their medical bills. So when you think about that, 20 adults out of every 100 are struggling to pay those medical bills. That 3 in 5 bankruptcies are associated with medical debt. And so, protecting your family's financial future is important. And then it also gives you access to health and wellness programs. So, these flu shots, immunizations, all those things that help prevent you from getting sick to begin with. And again, when you're looking at the farm, preventing someone from being sick, when you lose man hours, that can have a significant impact. And of course, in the end, we want better health outcomes. So, if we're actually filling our prescriptions because we can afford them and taking the medicine, and then we're heading things off in advance, you're going to be a healthier individual. And if there is a problem, if you can find that early and get it treated and taken care of, it's going to save you more than it would in the long run. So here's another chart for you, and this is a comparison of the 3 plans available in the health network. And so you can see you have the bronze plan, the silver plan, and the gold plan, and you have these terms over here, things like premium, deductible, emergency services, primary care physician, specialist, hospitalization. And you start to get an idea of why picking the appropriate plan is important, because the total costs are going to vary down here at the bottom of the screen depending upon what type of insurance you have. So I'm going to jump back to the screen, but my next slide says, what information does this chart give us? So I want you to look at the chart and tell me what information that you see is important on this chart. So looking for a chat response in terms of what information you feel is important on this chart. some responses in the chat box there. So deductibles and copays, the premiums, deductibles and copays, all of those are important. Important thing. Out-of-pocket maximums. You can see different co-insurance rates for the different plans. All of those are very important. And so the reason that we also bring this up is there's a lot of terms over there on that left-hand side. And so what we want to do is we're going to play the millionaire game. We want to see how you're doing in terms of health insurance terms. So here's our first question. What is a plan that covers services only if you go to doctors, specialists, or hospitals on the plan's approved list or network? You can go to any provider in any emergency. So we have four different choices there. You got point of service, health maintenance organization, exclusive provider organization, and preferred provider organization. So if you can tell me what you think the answer is in the chat box, that would be great. Got an answer of B. See what other choices we have. C, but it could be B as well. So again, we're going with the best answer. I have C, another answer is C. And that is correct, C. So an exclusive provider organization is a plan that covers services only if you go to doctors, specialists, or hospitals on the approved list. You have the point of service, which is a plan in which you pay less if you use providers that are in the plan's network. The health maintenance organization is a plan that covers care from doctors who are only part of that HMO. And then the preferred provider is a plan that has a special network or group of providers. So let's go on to question 2, $5,000. What is the amount you pay each time you visit a doctor, have lab work, or a diagnostic test? Your choices are co-insurance, co-payment, deductible, or receipt. Got some D's out there. And that is correct. A co-payment is a set amount that you pay for a covered service. Co-insurance is your part of the cost of a covered service. Deductible is the amount you owe for healthcare services your health insurance or plan covers before your health insurance or plan begins to pay. And then a receipt is, again, what you get when you pay for a service. The $10,000 question. A doctor who offers many kinds of services for patients, also called a general practitioner. Your choices are primary care physician, navigator, specialist, or preferred provider. Quick responses to that one, yes it is. Primary care physician. So this is the doctor who offers many kinds of services for patients, also known as a general practitioner. A navigator is a person who can help you look for health insurance coverage through the marketplace. A specialist is a healthcare provider who focuses on a specific area of medicine or healthcare. And then preferred provider is one who has a contract with your health insurance or plan to provide services to you at a discount. We're getting into the big money now. $50,000. A letter from an insurance showing what treatments and services were paid for. So there's your choices. Evidence of coverage, explanation of benefits, insurance coverage, and summary of benefits. So we have some B's there. So we got the explanation of benefits. The evidence of coverage is a document that shows what's covered, not covered, or limited in an insurance plan. Insurance coverage, again, is pretty self-explanatory. And then summary of benefits is a chart that helps you compare cost and coverage of health plans. $250,000, the maximum amount paid to a provider and is used as a basis for coverage healthcare services. This may be called eligible expense, payment allowance, or negotiated rate. $250,000. Yep. So several A's there. Allowed amount. Deductible is the amount that you owe for healthcare services your health insurance or plan covers before your health insurance plan begins. Out-of-pocket maximum is the most you can pay during a policy period before your health insurance plan pays 100% of the coverage. And I think co-insurance is a term we've already covered earlier. Any healthcare service to check or treat an emergency medical condition to keep it from getting worse. So what type of service is that? We have one more question after this one, which would be the million-dollar question. So we have several D answers. Emergency services is correct. Under these essential health benefits, we also have mental health services, preventative services, and these are things that, like your healthcare screenings, checkups, patient counseling to help prevent illness. Habilitative services include things that help keep, learn, and improve skills and activities for daily living. The million-dollar question. Premiums, co-payments, co-insurance, and the deductible are all examples of what? All examples of what? So the correct answer is right. The out-of-pocket costs. And again, I think these are terms that we covered earlier. And so you can see in the materials that we sent you, we have this important words to know, and you can print that out. And anytime you're not sure of an insurance term, this will help you give you an idea of what that term is and help clarify some questions you may have. So now I want to go back to the broken arm, and I'm going to present you with a couple questions. One is, how did the charges compare across plans? What do you notice in terms of the differences between plans? So yes, I do need the addresses to send a check. So anyone that won the $1 million, you can send that to my private address, and I'll write you a check for that, because I don't think Shannon's going to cover that through the Women in Ag budget. So many responses there. I need to scroll back up. Different premiums and co-insurance rates. So you can see there on the top, the premiums are different for the different plans, and the deductibles are different. Out-of-pocket maximum premiums are different. As the premium goes up, the cost of the deductible goes down. all these are good examples, and it shows the importance of why you need to really sit down and look at the separate health insurance plans and figure out which one best fits your needs. And Maria's going to kind of get into a little more detail about that later on. I think we covered my second question there, is what factors contribute to the differences. So what plan would you pick for Jamie? Looking at this chart, what plan would you pick for Jamie? The middle plan, the silver plan. So again, with this particular situation and with this information with the broken arm, of course, you know, the silver plan has the lowest cost specifically to Jamie. You know, now every situation is different. We were only factoring in here the broken arm, but there are other things that you need to consider as well. And we're going to get into that here shortly. So now we're going to jump into the what. And so what information do you need to get or find out, and what information do you need to compare or consider when you're thinking about health insurance plans? And so now I'm going to turn it over to Maria, who can take it over from here. Take me a second to pass the ball to her. And Maria, you should be in charge.
Thank you. So I get to share with you some strategies for really determining, you know, what plan might be best for you and what those plans might cost you. And to do that, I get to introduce to you the my Smart Choice Health Insurance Workbook. So this is one of the documents that was shared with you. It is, I'll share with you in a little bit, a website where you can download this as well and share it with your friends and family, because it's a pretty great resource to help learn how to comparison shop across health insurance plans. So this is the front page of the workbook.
Maria, if you can share your screen.
Oh, that would be a good thing, wouldn't it? So sorry. I thought I did that.
There we go. It's coming through now.
Okay. Perfect. So, so this is the front page of this workbook, and so as you're going through the documents that we share with you, I want to be sure that you pull this out and take a look at it. This workbook was really designed to help you sort through and comparison shop different plans and help you organize your thinking about how you might choose the plan that's best for you. So to get you started thinking about what your health insurance needs might be, this first chart, which is on page 6 of the workbook, gets you to think about, well, how did I use healthcare services last year? Because for the most part, unless it was some sort of accident or emergency, our healthcare usage is the same from year to year. And so the first chart or the first worksheet in this document is really helps you to inventory what's going on with you and your family and who you see, right? Whether it's a specialist or your primary care provider, and then how many times you went to see that. So one of the cool things I really love about this workbook is there's an important words to know column on many of the pages, and it really provides some of those definitions that can be a little bit confusing as you're trying to increase your understanding around health insurance plans. And so what we've tried to do is put the definitions right there on the page where you might most need them. So as I said, the first step is really to identify who you're seeing, how often, and you know, what kinds of services you're accessing. The next kind of important part of the workbook or the worksheet is this worksheet, and there are several sheets. This is just the front page of them, but you can see on this document, again, the important words to know are on the right-hand side. On the left-hand side in the blue column are the kinds of services and or decisioning points that you might need to think about as you're trying to compare plans. And then you'll see these three columns in the middle, right? The pink-headed column, the blue-headed column, and the yellow-headed column. And so this is an opportunity for you to actually look at maybe 3 different plans and begin to inventory them and review them based on the important criteria that's listed on the left-hand side. So, for example, what type of plan is this? Is it an EPO, an HMO, a POS, or a PPO? And you can begin to demarcate which of them it is, right? Is there a co-insurance for specific services? And most insurances do have co-insurances for, and they may be different based on the service that you're interested in. Can I choose my healthcare providers, or do I have to, you know, change providers because the network might be different, right? Do I need a referral for specialists? So all of those kinds of things can be important to your decision in terms of which plan you might pick. Another really important page, which begins to get you to think about, well, what is this plan going to cost me over and above my health insurance premium. And so this particular one is getting us to look at prescription drug costs. And so in this worksheet, what we're looking at is if the cost of prescription drugs is covered within a plan, an existing healthcare plan, you can kind of calculate out, well, how many prescriptions and what's the copayment for those prescriptions based on each of the different plans you're comparison shopping. That's row 1, right? Row 2 is if you have to purchase a additional prescription drug plan over and above if your current healthcare plan doesn't include prescription drugs, right? So that's what row 2 is about. It starts to get you to calculate out what the premium is as well as what those co-payments might be. So depending on your healthcare plan, you may do row 1 or row 2. And then it calculates out, or you would calculate out what your totals might be across each of the plans you're trying to compare. So one of the things then that really is important to look at and think through is, well, how will this impact my overall monthly spending plan? Because one of the things, the trend that's really happening is more healthcare costs are being pushed down to the consumers. And so we have our premium costs. We may have a larger deductible that we might be responsible for. And then some of the co-pays or co-insurances may be going up. And so I think, you know, the trend is, well, what we're moving away from, I'll just say, is oftentimes we made our decision about which plan to pick based on the premium. And what this workbook really helps us look at is, well, what are the other out-of-pocket costs we need to be considering and planning for so that when a healthcare event happens, we have the money. So as we see a trend towards larger deductibles, hopefully we never have to use them, but if we do, we need to have the money set aside. And so beginning to think about how do I build in the money to cover a deductible is really important. And so building it into the spending plan is part of what needs to happen. So those of us who have a nice chunk of change saved away as an emergency fund, we may think of that as our deductible, right? We have money set aside in case we need it. Others of us who may not have that nice chunk of change set aside in an emergency fund, we may need to start to build it into our spending plan. And so as we see the trends moving around how the cost of health care is being pushed down to consumers, we need to begin to rethink two things. One is, calculating out what is the total cost of this particular plan, not just considering the premium. And two, how do I begin to shift my other living expenses around so that I can have the money I need to access care? Because the other trend we see is, well, people don't go to the doctor because they don't feel like they have the money. And then for health reasons, or how do I want to say this, if health isn't attended to, then things can get worse in the future. And so part of it is about how do you keep yourself healthy so you can continue to work and do the things that you love to do, as well as keep yourself financially healthy, right? Because typically preventative care is cheaper than chronic or long-term care. So things to consider and to build into your spending plan. So key questions we kind of talked about, right, already is, why do I need health insurance and why is it important? And what information do I need to get or find out, and what do I need to compare or consider? That workbook will really help you address the what information do I need or need to find out in order to compare. So I'm going to ask you to kind of type into the chat box information about, or where you think you can get information about plans as you are trying to compare them. So what's a good place? Where would you go for information about a plan that you might be considering? So type that into the chat box. So right, many people are saying the healthcare marketplace, the health insurance company themselves. Absolutely, those are great places to check it out. The healthcare marketplace oftentimes has more specific information about each of the options available, or that are, one of the options that are available. So one of the things that you should know is that every single healthcare plan out there should have a document associated called the Summary of Benefits and Coverage. And it is sort of an abbreviated, maybe 8-page document that outlines the key important qualities or characteristics of the plan. For example, what type of plan is it? An EPO, an HMO, a PPO, is there a deductible and how much? What are the co-payments? What are the co-insurances for key services? What is considered, do co-payments and co-insurances count towards a deductible, or is the deductible over and above co-insurances and co-payments? And each plan is a little bit different, and so you really need to compare and check out those different aspects of a plan.
And Maria, as you and I have mentioned before, farmers can often find them in a unique situation where they're comparing private insurance plans that are on the marketplace versus employer-sponsored plans versus plans that may be offered through some type of co-op. So you have a lot of different options that you need to look at and explore and compare. as you try to figure out what best meets your needs and what best meets your financial situation.
That's exactly right. And I think because there's so many options, it can be even a little more confusing to really make a smart choice. So here are some resources from the internet. You know, all of the health insurance literacy initiative documents and information that this team has created are on the University of Maryland Insure website, which is this first website here. Of course, healthcare.gov is a wonderful website. I have to, and sometimes it's hard to say that about a government website, but this one's a pretty darn good one. And Consumers Union has done a lot of work around this, and then the IRS has done some work around understanding kind of medical costs and what could be considered as deductible and considered a potential business expense as you're trying to determine, you know, does this become a business cost and under sort of the risk management strategies of the farm business, or kind of on the family side and trying to determine whether or not you've met the threshold to deduct medical expenses on your income tax. So that's what this IRS publication can help you kind of sort out. On the healthcare.gov website, or actually this one, really, the healthcare.gov website, it will help you connect to the health insurance marketplace. And the health insurance marketplace in Maryland, well, in every state is a little bit different. Maryland has their own marketplace. In Delaware, we partner with the federal healthcare.gov website. But this is a great, I'll just say, kind of front door to getting access to whichever the state resource around the marketplace options. And so to go to this website or your state website and begin to put in information about, from a family perspective, what, you know, it asks you for things like, you know, where do you live, how many people in your household, what are their ages, how are there any smokers, and then your income. And one of the helpful things that the website does then is it helps you see what plans you might be eligible for. So if your family income is below, you know, a certain threshold, you actually might be eligible for Medicaid, which is the federally and state-run program for limited resource audiences, limited income audiences, that gets you access to health care at a very inexpensive rate. For those who are kind of above that threshold, but up to like 400% of the poverty level, which is pretty high, it may offer you tax credits and subsidies that can help offset the cost of the premium. And so for many families, this has been very, very helpful to help offset the cost of the premium. Once you hit that 400% of the poverty level threshold, then your options sort of widen because there is no tax credit or subsidy benefit, and so you can really choose plans that are not on the healthcare marketplace, meaning you can really go to other companies and do some comparison shopping across companies. So from an individual family perspective, this may be an option if you are not getting insurance from an employer-based system, right? So, because the rules currently say if you have access to health care insurance through an employer, then this other system isn't open to you. But if you're not getting insurance through an employer-based system, going through the healthcare.gov website is something available to you. So it is something to explore as you're comparison shopping across plans. So I'm going to stop there and just say, what questions do you have? Because we just threw a lot of information at you, and I'm sure you have some. So I'll take a breath and let you type, and then we'll try to address questions that you might have.
The one thing to add there with the workbook, Maria, is that on that website that I put up there that has the consumer resources, it is set up where it can be a fillable form, so you could just type in how many times you visit a doctor, the cost, and it'll calculate all those figures for you. So we have 2 copies of the workbook that are available online. One is just like the one that you had access to before the webinar, and the other has the fillable form feature.
Oh, you can see here on this page little blue squares, right? It's fillable, and then it'll do some calculation for you. So that's very handy.
I also posted in the chat area the Maryland Health Connection site too for anyone that wanted to look at that as well.
Great. And in Delaware, it's all one word, choosehealthde.org. I'm not seeing any questions. Are you seeing any questions?
Not on mine.
Okay. All right, well, then I'm going to proceed here. So it's time to do the post-assessment. Jesse had introduced this, kind of the second slide, and hopefully you kept that URL open and can take a moment and just answer this post-assessment. This really helps us improve our programming. And would really appreciate your feedback. So here is our contact information, and please feel free to reach out to us. I'm seeing we have a little typo. It's my last name at udel.edu. So that would be a good thing to fix. But it's Papitas at udel.edu, and this Ensuring Your Health website is awesome, I have to say. It is chock full of all sorts of information that will help you better understand health insurance and make wise decisions and use it wisely as well. So with that, we want to thank you for participating in the Smart Choice Health Insurance Basics program for farm audiences, and again, we're open to taking any questions.
Great. Thank you very much, Jesse and Maria. We'll leave it open for a little bit, see if we have the questions. There was a Q&A. Send a question via the chat and question box. Okay.
So the question is, we didn't talk about pre-existing health conditions or health issues that were treated and how these would affect premiums and coverage. So, and Maria, feel free to share, but, with the Affordable Care Act, you can't be denied right now with pre-existing conditions. So those rates that you have in the marketplace, take all those factors of pre-existing conditions into consideration when they determine the rates?
So, you know, in the 2018 health insurance year, we're still under the Affordable Care Act. This issue around pre-existing conditions is still under debate by Congress. And so this is one of those things where you should call your Congress people and let them know what you think about this, because it is something that is being debated about whether or not it should be retained in whatever the healthcare regulations are in the future.
And one item that they kind of have toyed around with is what we call these skinny plans that don't necessarily have all of the essential health benefits in it. So you do want to make sure that you do have all the essential health benefits, because that is the comprehensive health insurance program. You get into these short-term plans, there's going to be things that may be excluded that wouldn't necessarily be the case when you have all the essential health benefits included. And then the other question was that you didn't get the documents. So the documents, I sent a web link in the chat box with consumer resources. Also, the information that Shannon sent to you has a link that'll take you to all the resources that go along with this program as well.
Great. Any other questions? We will be sending the link to this recording as well as the presentation and supporting documents. And also listed on the website will be Jesse and Maria's contact information if you'd like to follow up with them. All right. Any other questions? I'd like to thank Jesse and Maria for presenting today. I really appreciate it. Very important topic. So we'll be talking about wellness and health and mental health next year as we roll out the 2019 webinars.
Thank you, Shannon.
Yeah, thank you. And thanks for everybody for joining us.